I'm Deborah Borchardt with the Green Market Report, and we're here with Dr. Joseph Tucker from Enveric Biosciences. You know, one of the things that's really interesting to me about your company is that it is straddling the world of cannabis and psychedelics. You're both in cannabinoids and psychedelic medicines. Do you feel at some point that you might choose one over the other?
Wow. That was a question I wasn't expecting. I think it's always possible. Right? It's always possible. What we are coming at this really from an efficacy. We're drug developers. That's all of our backgrounds. And so what we see is the opportunity to treat various conditions, and we just want the best tool available. So, one of our lead programs on the cannabinoid side is for radiodermatitis, where we're using cannabidiol. And, there's some well-known efficacies of cannabidiol that really haven't been properly utilized pharmaceutically. So we see this as like this great opportunity, this big need. But on the same side, on the psychedelic side, we see, again, for cancer patients, a huge area of unmet medical need, which is this cancer-related distress. And for them, cannabinoids are not the best answer, right? Psychedelics are game changers in that particular field. So we like to call ourselves molecule agnostic. Right? We want to use the very best molecules that will treat the patients. So at this point, why make that choice? Now, having said that, both of these industries are very, labile. They change a lot, they move a lot, there's opportunities here and there that happen. So if something were to change and it made it make a lot of sense to really focus on one entity over the other, one class or the other, sure, we would look at that if that arose.
So there has been so much movement in the psychedelics, and it's been moving very quickly. Do you have any concerns about commoditization of certain compounds like a psilocybin?
Yeah, I absolutely think that's exactly where it's going to go, honestly. The way we look at it, we think of those, we describe the originals, we call them the classic psychedelics, or the Gen 1s. So the LSD, psilocybin, MDMA, all of these things are pretty much unpatentable. They've been around forever, and there are many ways to make them. So a lot of the classic ways that you would try to create a monopoly over such molecules aren't going to work very well in the classic psychedelics. And we actually saw that, honestly, on the cannabinoid side too, right? CBD is available everywhere. And so you really only had the one company, GW, that was able to make a monopoly out of it, and it was only based on their orphan designation. Once that orphan designation goes away, I think that's becoming commoditized too. So I absolutely expect that on the psychedelic side, and that's why at Enveric, we've actually taken a different approach. We expect that's what's going to happen. We think there's a lot of value in those molecules and a lot that can be learned, but ultimately we think the big opportunity is to modify them, create better molecules. In doing so, they're better for the patients, but they're also patent protectable. And so that's our approach, is to go after what we call Gen 2s and Gen 3s, modified, better, and patent protectable. We think there's always going to be a market. There's always going to be a place for the classics, but the Gen 1s, but I do think they will be commoditized for sure.
With your acquisition of Magic Med, you got the Cyberray.
Right.
What is your vision for the Cyberray? Because that kind of fits in a little bit with this Gen 2 and 3 molecule idea.
Yep. Yeah, so that's exactly the Cyberray. You're right. It's a very large portfolio of Gen 2 and Gen 3 molecules. And, they're based around a couple of the classics. So they're based around psilocybin, DMT, the tryptamines, and also based around the molecules behind, say, mescaline and MDMA. We see those molecules as being great, let's say, originals, proof of concept that those molecules bind very well, and that's where we're making all these modifications to create better versions and create this very large portfolio so that we have lots of different, hopefully better versions that you can put into different patient populations. This modified version is the best possible thing for cancer-related distress. This one is the best possible for, let's say, opiate addiction. That kind of thing. That's exactly where we're trying to go with the Cyberray. And what we think its power is to open up the doors to all of those different indications.
You've got so much going on with Enveric. Between the cannabinoids, you just did this deal with Israel, and that's pretty exciting too with the CBD. It's almost like this next question is almost like choosing your favorite child. Like, which out of all these things that you've got in your portfolio, which is the one that you're the most thrilled about?
Yeah, that is just like asking me which of my kids is my favorite. So certainly we love them all. I guess to be honest, and I do have, quite a history in cannabinoids as well as psychedelics, but I have to say that the profound impact that we have seen from the psychedelics in the areas of mental health and this crying need that we have, and a lot of psychiatrists that I talk to they're calling it a renaissance, right? It's not me. They're saying this is a potential renaissance in this field. So that gets me the most excited. At the end of the day, to have the most possible impact, most powerful, positive, a lot of P's, positive impact on patients, that's what gets me up in the morning. So for me, going after, in particular, cancer-related distress as a first foray, as one of those ones where you need something and this is probably going to work, go for it. That's my favorite child right now.
Thank you. That is Dr. Joseph Tucker with Enveric Biosciences, a company we're certainly going to keep our eye on.